You're listening to Health Innovators, a podcast and video show about the leaders, influencers, and early adopters who are shaping the future of healthcare. I'm your host, Dr. Roxy Mooney. Welcome back to the show, Health Innovators. On today's episode, I'm sitting down with Matt McBride, who is the CEO and co-founder of Mend. Welcome to the show, Matt.
Yeah, Dr. Roxy, it's great to be here. Thanks for having me.
Yeah, you bet. So start off by just telling us a little bit about your background and what you have been innovating these days.
Yeah, absolutely. So I'm the CEO and co-founder of Mend, and Mend was really sort of a passion project between myself and three best friends, really. We had built some other companies, had some successful exits, and we really wanted to build something that would be part of the solution in healthcare. And where we really chose to focus was around patient engagement, sort of changing or modernizing those touch points that a healthcare organization will have with their patients. So kind of moving from that, clipboard, fax, phone call to, self-scheduling, doing forms digitally, payments digitally. Telemedicine is a big thing that we do. So we really wanted to try and, change that experience and make healthcare easier for everybody. So that's kind of what we work on and what we help our customers with every day.
So were you in healthcare previously, prior to Mend, or was Mend your, first stint in healthcare?
Yeah. So, we were kind of talking about Orlando before the show, and I actually moved from Michigan to Orlando to join a healthcare startup. And it was actually a startup that failed. So, a lot to kind of learn and kind of take into other ventures. And then I worked for Varian Medical Systems, helping a lot of medical oncology practices. And then I kind of went off into the ed tech space, and I ended up building an ed tech company, and then deciding, healthcare is really kind of where I want to be and where we could maybe have a big impact.
So much innovation, so many problems to solve. There's certainly room for all of us and more.
Yeah, I mean, at the end of the day, everybody's a patient, right? Even doctors are patients. Everybody's a patient. Everybody's going to be a patient. So I think just the ability to have an impact and kind of have a mission behind the business. Healthcare, there's really no better place, I think, to try and do some positive things.
So let's start off by saying, just talking about what are some of the lessons that you learned in those previous businesses, and, how did that translate into what you've been doing with Mend over the last few years?
Yeah. I guess I kind of think of it as, I think one of the key learnings was sort of understanding maybe the size of the market. I think a lot of times people will maybe throw around ideas and just, sort of jump right into it. And when we were when we had this mindset of, all right, we want to, do something big and create something bigger that could maybe help a lot of people. Well, is there a market for that? Is the market big enough to support that? And what is sort of that total addressable market, right? And so I think that's definitely sort of one key area or sort of one key learning. I think that in the failed startup, there wasn't really a fit for what we were doing. And I think also that we really, I think maybe a lot of people think that if I build it, they will come. And I think we thought in this business that, we were just going to be able to sort of bring everybody on this platform overnight versus maybe sort of going out, getting some early adopters, really working with them to understand the problem better than anybody else, and kind of, sort of continuing on from there.
Yeah. It's something that I think a lot of people face, is that struggle of kind of getting a little bit blinded by the solution, and really then going out, actually building the solution, raising money, building the solution, having it ready to go to market, and then looking for a problem to solve.
Yeah, I had watched this chief product officer one time kind of give a pitch, and really one of the point he was trying to make is like, you have to understand the problem, right? The problem is what is sort of where customers will go out to find a solution, and solving that problem has some value to them. And in this presentation, the presenter brings up this Bluetooth connected salt shaker. And so it's something that I kind of, point back to from time to time, like, well, what problem does that solve, right? By having like this Wi-Fi Bluetooth connected salt shaker. And I think a lot of times, customers will come to you with a solution, and we always try to take a step back. And I think just, understanding the problem from your customer's perspective, understanding that better than anybody else is really going to help you find that product market fit.
Definitely. So it's like you've been watching some of our videos, listening to our conversations here. So what did you do differently when you started Mend in 2014? How did you get immersed in the problem and get a really good sense of the customer's world and, the jobs that they were looking to address and solve?
Yeah. We actually made a significant pivot at the end of 2015. So when we started the company, we thought, okay, well, we should control the entire experience. We'll have a software engineering team, and we'll build, scheduling, and we'll build telemedicine, and we'll build forms and reminders and all of these things into software. And then we'll have medical providers as well. And, we had a clinic, we had some mobile doctors, we had some telemedicine options. And I think at the end of the day, we decided, well, I think the software, instead of trying to compete with all of these other, great providers in the area, let's just take our software to those providers and help enable them. So we kind of made that significant pivot, and from there, I think you're sort of guessing a little bit, and I think the guess we sort of took was, telemedicine is going to have some significant role to play in the future of healthcare. And that's what we started talking to different customers about. And even though it wasn't necessarily supported from the federal government perspective, it was being supported on a state level through Medicaid, and commercial payers were starting to pay. So from there, we started working with a lot of early adopters and a lot of pioneers really in telemedicine. And that just morphed into, okay, well, now the patient's at home, we have to be able to do all these other things. What if we need to get them a doctor's note? What if we need to do this? And so from there, it just kind of grew into, well, just selling a telemedicine platform isn't as interesting because organizations are still going to have in-person visits. There's still going to be time where you need to see the person in person. So let's develop sort of this comprehensive solution, so all of these touch points with the patient can be, more modern and more convenient for everybody.
So, what was the adoption and interest in a telemedicine solution? I'm assuming that you're talking about prior to COVID. Obviously, we know with COVID, it was that adoption was accelerated significantly. But what was it like for you prior to COVID?
Yeah. I mean, every doctor was open to talking about it. Now, if they implemented it, were they going to get paid for it? That was, that was the question.
Wow.
And so I think I think sort of another key learning in sort of, taking a business and getting it off the ground is really having, whether you sort of bring on a VP of marketing or partner with an agency, but I think really having a strong marketing strategy. I think we were able to get out there on the internet and have a presence online and really tap into a lot of people that were, really interested. And what we found is there were a lot of groups that had high no-show rates that were really interested in implementing telemedicine to solve that. And that was kind of a big part of our business before the pandemic.
So I want to unpack a couple of things here. First, just the observation or the recognition that you had of the importance of marketing and a marketing strategy. You don't hear that from a lot of healthcare companies. When you think about them building out teams, building out departments, fundamentally, I think as a whole, healthcare and as an industry that's probably been one of their weakest areas, has been marketing, kind of maybe more focused on sales and doing this, the sales team doing that business development, that uncovering of leads and opportunities. Thinking of marketing as, people that were, designing booths at trade shows and, blowing up balloons and, designing stickers kind of thing. And what I love what you just said, because you really pointed out the strategic foundation that that role plays and how it can impact your business. And then what you said is just kind of how you reframed it, right? So telehealth framed as solving the problem that they had, which is how do we eliminate or reduce no-shows, being able, having marketing be able to help with discovering what is it that problem is, that they're the biggest pain point that they're looking to solve for. And then how can you package your messaging and position your solution around solving that problem? That's a game changer in your commercial model.
Yeah. I mean, and I think, we talk about this sort of product market fit, right? And we felt that we were onto something with telemedicine. I'd read some, books where, people have used Google to test book titles and sort of the ad lines and stuff like that. I think Google is this really powerful resource that an entrepreneur has I could go to Google and I could understand if there was a pre-existing market. Were people actually in the market for telemedicine? Because if not, maybe there's a problem, or you have to do something a little bit more expensive, which is try to educate people, or sort of make a new market, which is a lot harder.
Twist their arm. Yes, you need this. I mean, honestly, that's what we have an army of out in the marketplace. a lot of Me Too solutions that aren't solving problems that either exist or that are big enough pain, high enough priority for someone to actually want to exchange dollars for. So explain what this Google secret is for everyone in our audience.
Yeah, I mean, the best way I like to describe it is there is this old saying in business, like location, location, location. And I like to think of Google, that's the new location. There's Bing and there's other places that you do have to pay attention to. And so when we would find traffic and demand, let's say telemedicine software. All right. That's pretty specific, probably to a healthcare organization that's looking for this. And there's a decent amount of search volume. I mean, literally within 10 minutes, you can now be the top result if you can fund that. And that's just an incredibly powerful thing to then have people that are in market. They're in market. They have a problem clearly because they're looking for this solution. It's a very powerful way to just start to get in front of people and show them what you have and have the conversation and what's the problem, what's going on. Help me understand that. And that's really how I've built both of my companies, is just by really having a good marketing plan to get out there and get it in front of people and make sure that we had the right product market fit.
I think that's so powerful because especially in healthcare, it seems as though there's so many players in all of these different like micro markets within healthcare. It's really easy to be almost in a commoditized market in healthcare, right? When you think about EHR, when you think about telehealth, when you think about patient engagement, when you think about health systems, medical urology offices, when you think about all of these different solutions in healthcare, you very rarely see, just a handful of players. There's usually hundreds, if not thousands. And sometimes people's, those entrepreneurs, their winning strategy is based upon having a better widget, better solution. But sometimes you could have an inferior product. And I'm not saying that you do by any means. I'm talking about anybody. If you can win at marketing, you can have a really good product and be a marketing wizard or apply the best practices around marketing and really leapfrog all of your competition just because you're better at marketing.
And I would say that it's certainly a path to generating revenue faster, which is ultimately, when you're talking to investors and they're talking about product market fit, that's really what they mean. Are you generating revenue, and how fast is that growing? So it is really a path to proving that. Can I solve a problem that's valuable to somebody and they're willing to to pay for that? And I just think the other part is that these folks are in market. They're looking for a solution that you have. If you're trying to sell a car to somebody who already has a car or doesn't need it doesn't have any use for a car, that's a lot harder than if they're online looking, shopping for that. So I think founders don't have to be experts at everything, but get an expert in marketing or in digital marketing that can allow you to tap into that and really see if you need to pivot or if you're onto something.
So I think healthcare as an industry is certainly evolving, right? A decade ago, you probably saw, or you definitely saw a lot more missed opportunity around, marketing and some of these best practices, right? Just because of the way the industries was structured, you could have a wildly successful business without applying any of these best practices that other industries have to do in order to survive and grow and scale. So, just kind of what's your take as you think about not only for your own business, but as you kind of look at the landscape and healthcare? Are we growing up? Are we getting better at digital marketing and recognizing the contribution and making those investments? Or do we still have a real long way to go?
I mean, I definitely think there are a lot more modern solutions that are investing heavily in digital marketing, but there's still reps going, buying lunches, going to offices. There's still kind of all of the the above
Donuts,
really.
donuts, cups, mugs, pens, and a
Exactly.
brochure.
Exactly. And there's still, I think, some medical offices and practice, like that's what they expect. That's how they've looked at new offerings their whole career or the whole life of the company. And maybe that's kind of more what they expect. But I think we've really I think felt that there's a lot more people online doing research, and it's definitely moving in that direction. And certainly buyers within healthcare, I would say there are a significant amount of them that are doing their research online these days.
Yeah, statistically, over 80% of the buying process is complete before anyone ever picks up the phone and calls you and asks you for information about your company. That they're doing all of that due diligence way before. So if you're not doing marketing, you're not doing inbound marketing, you're not doing content marketing, social media marketing, you're not part of that process. You're not even on the radar when they've already made it through 80% of that buying cycle.
I believe it. And I just think what a powerful way to get your solution out there. Because like I said, you can be at the top of Google, in 15 minutes, in a matter of 15 minutes. So the world is becoming a much smaller place, and it's definitely a good way to get a business, get a startup off the ground.
Hey, it's Dr. Roxy here with a quick break from the conversation. Are you trying to figure out what moves you need to make to survive and thrive in the new COVID economy? I want every health innovator to find their most viable and profitable pivot strategy, which is why I created the COVID Proof Your Business Pivot Kit. The Pivot Kit is a step-by-step framework that helps you find your best pivot strategy. It walks you through 6 categories you need to examine for a 360-degree view of your business. I call them the 6 critical pivot lenses. As you make your way through this comprehensive kit, you'll be armed with the tools, tips, and strategies you need to make sure you can pivot with speed, without missing out on critical details and opportunities. Learn more at legacy-dna.com/kit.
Yeah, I'm kind of embarrassed to say that there's, one client that we work with where we actually still do a fax marketing program for them. And right, so the fax machine, but we also do a pay-per-click advertising program for them, right? So it's really strategic and really meeting customers where they are, just like you described. So there is a subset that are still looking at fax, and fax is still a viable communication channel, but they're not relying on that solely, and that they are investing in digital advertising and outposts, like Facebook or Google or any of these other platforms, to be able to meet that subset of the population or their customer segment in that channel as well.
Well, I've heard, when I kind of, really started to get into marketing, I had heard, about 5 touches, right? And now our marketing team is saying, we need 12 to 15. So, there could still be a role even, for direct mail, for the faxes. You've got, maybe you're doing webinars, there's maybe opportunities for texting and email. And so, I mean, those opportunities, if you're thinking about, well, I've got to come up with 10 to 15 touches, I wouldn't rule out some of those mediums.
Well, and I love what you're saying, because too often what I hear is I'm just making the story up, paraphrasing some of my prior conversations and experiences, but I raised $5 million. I put $4 million into the technology, and then I used, let's say another $500,000 for operational cost and so forth. So I have $20,000 to go to market. And it's like, oh my goodness, no, now you should actually have, maybe a couple $100,000 in your pocket product with the lean MVP. Obviously, it needs to be functioning, needs to be safe for everyone that's involved, but you need to have a big old budget to drive those early adopters and drive revenue. So that way, then you can build those additional features and functionality in that solution. Some kind of way we need to be able to flip that perspective on the value of creating awareness and creating demand, as opposed to these traditional mindsets of, going back to the arm twisting face to face.
Yeah, I mean, going back to the failed startup, I really felt like we built a really great product that nobody used. So if you don't have that MVP, if you don't have some customers that are really going to help you shape the product, I really felt like we just spent a lot of money developing a bunch of stuff that nobody ever used and and nobody was ever going to use because it's long gone now. So I mean, I think the sooner you can get into marketing, like you said, the MVP, or even, if there's customers, people that however you can get those customers through your network or digital or whatever, it's going to be so important to, not only make sure that there's product market fit, but so you can build it correctly and really understand. Otherwise, you're just sort of, building it all off of assumption.
Yeah. And there's too many people out there doing that. That's why we have all of these solutions in what I call the zombie graveyard that's sitting there, and we've got a 95% failure rate, and we're not going to move that needle until we start rethinking what our commercial models and some of these go-to-market strategies and plans need to look like, for sure.
Yeah, healthcare does seem like one of those industries too, where just a lot of great sales teams were built to sell a lot of not great products.
Yes, I agree. And did it really well, right? Did it really well, and still are. Think about some of the solutions in the market that we're kind of like stuck with because they had such great sales teams across the country that are just kind of embedded into the healthcare infrastructure now that are terrible, but we're stuck with them because they had great salespeople and convinced us to give them millions and millions of dollars.
Yeah, so I guess a great sales team never hurts either.
Right, exactly, 100%. So let's talk about patient engagement. We've been talking about being patient focused, patient centered. We've talked about relabeling the patient to a person because they're not just a patient. Kind of thinking about their entire context before, after, not just during the healthcare experiences. How does consumerism affect your vision for patient engagement in the future of your company?
Yeah, well, I think on average now, the patient or the customer really is responsible for 35% of what's being collected. So more and more, the patient is coming out of pocket for what they're receiving, which means they're going to want real value, mixed with all of these other industries, right? Where I can swipe, click, whatever, and I've got a package showing up, in a couple hours, or I've got transportation, or I've got food showing up. And so I think all of these other industries have shown, well, this can be done. So wait, I'm having to pay all this money for healthcare. I value the money. I work hard for my money. I value that. And so I think more and more you have that, along with everybody's got a voice online. People can leave reviews. The government is even forcing in organizations to collect reviews and is offering rewards or penalties based on satisfaction scores. So even I think the government is sort of pushing this as well. So I think a lot of organizations are understanding, okay, people are expecting, they want to be able to schedule their own appointment online. They want their appointment reminders and text messages. They want to do forms digitally. They want telemedicine as an option. They want to pay their bills electronically and have a frictionless experience for that. And I think that's ultimately a lot of the different experiences that we're reshaping for healthcare organizations, is sort of modernizing those touch points with their customers.
Yeah, one of the things that I heard in just some of the work that we were doing recently was even from patients wanting to be able to kind of break down some of the silos between the healthcare providers and being able to talk to the pharmacy, the medical office, kind of all in one communication channel, as opposed to having to call the office and then call the pharmacy and then call them back and try to relay all of the information that's being communicated and being that intermediary, but just having one unified communication channel when it's appropriate, just streamlining those communications. Again, because there's so many other industries that are leading the way in convenience and digital experiences, and that's the bar now.
Yeah, well, and you've got Amazon that just acquired One Medical, and they've made pharmacy acquisitions. So, you've got Walmart and some of these other big retail types of companies that are buying these different pieces, right? And so if healthcare organizations don't figure out how to put this together, they're gonna, have a rude awakening, because when you see what these titans are putting together. But yeah, I think it is very much in today's healthcare system. You have to really be your own advocate, it seems like, to kind of get the care that you need, and the organizations that streamline communications and bring the conveniences and the access. The patients are going to migrate to them and leave, the old models.
Absolutely. I've been saying this for years. Like, if we as an industry don't get our shit together, that these big players are coming for us, right? They understand customer experience and digital in a way that healthcare as a whole just doesn't. And like, we can't just deal with excuses anymore of why we can't have interoperability, why we can't do telehealth, why we can't, all these, I don't get reimbursed, I won't get paid. No one else. If we just keep making up all of these excuses, and I think we're chipping away at that, right? I mean, the pandemic, for all, we've talked about this so many times on the show, for all of the terrible things that we've experienced from the pandemic, accelerating the adoption, having, maybe more stale status quo healthcare leaders reimagine what could be done and what has to be done in healthcare has certainly, changed. And I think that's been, great, because if we don't wake up and we don't move fast in implementing all of that, we are at risk to be Blockbuster and Kodak, and nobody wants that.
Yeah, I'll kind of circle back to something that I think is a little mind blowing, but it is significant when you're working in healthcare. But I think one of our hardest challenges, right, is how do we deal with all of the regulation, all of the roadblocks, but still come up with something that's frictionless. So a lot of the times, I'm pushing you got HIPAA, and you've got all these rules and regs and all these other things that you have to deal with. And I'm always
Well,
trying to
and isn't
challenge.
that just funny where everybody wants to say, oh, we can't do it because of HIPAA. And you're like, patient health information is not even included, but they're just throwing HIPAA around anytime I don't want to do something. Oh, we can't because of HIPAA.
Yeah. And it's like, well, we have to find the balance somehow, some way. We have to find that balance because it should be frictionless. But here's something a little mind blowing relative to telemedicine is that most people don't know that we didn't have telemedicine before the pandemic because the federal government said, well, your home is not a qualifying originating site. And they said, the patient has to be in a rural designated facility that they designate as rural. So I think, a lot of people are kind of blown away by that. There was no way for a doctor to get paid. And the only way to get paid, the patient still had to come in. You couldn't be located anywhere. So it on the one hand, with the pandemic, it's well, why does it have to get to that level to make a change to increase access to care? But then on the other hand, it's like the whole world can just change overnight. It seems like, to make a change can be very difficult. And then just look at the changes and everything, just how everybody adapted across the world overnight. Telemedicine is here to stay now. And I think some other doors were opened up. It was kind of blocked by politicians for a long time.
So as someone who's been in the trenches for a number of years, who's pivoted, who's had some failures and learned some lessons, who has been able to ride the telehealth wave and then reinvent yourself, or not really reinvent yourself, but really expand into new solutions so that way you can help your customers solve more problems. What's next for Mend? What is next for you over the next couple of years?
Yeah. Payments, making patient payments more automated and frictionless is sort of a big new product for us this year. But yeah. I think our vision is really around having a complete digital check-in process so that we can get forms, we can get co-pays, the check-in, maybe even get your vitals before you ever arrive, right? Having patients start to invest in their care before they ever show up for an appointment, have the appointment. And then, I think a problem we'd like to get into at some point is how do we help healthcare organizations that are struggling to find staff? And then how do we help reduce some of this administrative burden on providers and the amount of time they're having to spend? Yeah. So what can we do to maybe help, build workflows and work with other partners to maybe handle some of the documentation automatically? And I think ultimately working towards this vision where, ideally patients and providers can just sort of spend time together, diagnosing, managing, just like you and I are spending time, right?
Yeah.
How can we bring that human element? Even, we want to, all the things that we kind of have to do, we can do that digitally, and we can get that done in advance so that as it comes time to receive the care, how do we make it so that providers can do what they really wanted to do, which is help people. They don't want to do documentation. So I think that's, a couple of years down the line, that's another kind of frontier for us is just making things more frictionless for providers and staff as well.
Yeah. Well, and I know as patients, we want it. Anything that could make that experience so much better. I mean, there's nothing that makes me want to roll my eyes more than when you go into a doctor's office and they give you the clipboard with the paperwork that you've already signed, filled out so many different times. It's it's not frictionless now, but we are making progress.
Absolutely. Absolutely.
So what do you, as we wrap up here, do you have any additional recommendations or best practices, lessons learned that you would want to share with other innovators that may be at different seasons or different stages of the innovation or commercial journey?
Yeah, I mean, I think the last big one is just not quitting. I think, your tolerance, if you're building, maybe, your ambition is to build something a little bit smaller. I think that's great. Your tolerance for stress and pain maybe can be a little bit lower. But if you have, if you really want to get out there and make a big impact, I think you really have to come to the realization that, your tolerance, you cannot be a quitter. And that, especially in healthcare, because there's so many rules, regulations, just all sorts of things that you have to work around. I think, that's a huge part, as well as you got to just keep going.
Absolutely. Resilience. This is not for the faint of heart, is it?
Absolutely not.
Well, Matt, thank you so much for joining me today and sharing with everyone. How can anyone get a hold of you if they want to follow up with you after the show?
Yeah, so you can definitely find me on LinkedIn. I'm easy to find there. Mend.com is our website, MEND.com. So it can definitely reach me through that as well. And happy to connect and help if anybody ever wants to reach out.
Excellent. Thank you.
Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and attention. To get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who shared the show with friends and colleagues. See you on the next episode of Health Innovators.